In vitro fertilization, or IVF, is the joining of an egg and sperm in a laboratory dish. The first step is stimulation. A woman is administered fertility drugs in order to influence the ovaries to produce several eggs instead of just one. Egg retrieval occurs secondly by follicular aspiration, in which a physician uses an ultrasound to guide a thin needle through the woman's vagina into the ovary and egg-containing follicles in order to collect the eggs. The third step is insemination and fertilization. Sperm are placed with collected eggs and penetrate them within a few hours.
He's going the distance. He's going for speed.
If the physician thinks that the chance of fertilization is low, intracytoplasmic sperm injection, or ICSI, may be performed, where the physician uses an instrument to directly inject the sperm into the egg. The egg is cultured and divides to become an embryo. Lastly, the 3 to 5 day embryos are transferred or placed into a woman's uterus. The exact number of embryos implanted depends on multiple factors, especially age. Unused embryos can be frozen in order to be implanted later or donated. Prenatal screening is a procedure used to detect fetal diseases or genetic abnormalities. This can be done by multiple invasive and non-invasive screening methods. The most common screening procedure is amniocentesis. A long, thin needle is used to extract amniotic fluid for testing. This occurs between 15 and 18 weeks of pregnancy and has a 99% accuracy rate. However, 1 in 200 results in a miscarriage.
Women who choose to have amniocentesis do so in hopes of receiving the peace of mind that the procedure can offer them, if their baby is fine. When the news is not good, the test results allow parents to prepare for the birth of a baby with special health problems, or potentially to make an informed decision about termination of pregnancy.
A surrogate mother is a woman who carries and gives birth to the child of another woman who is usually infertile by way of a prearranged legal contract. There are 2 types of surrogacy, traditional and gestational. Traditional surrogacy occurs when a woman receives sperm from the intended father or a donor. She therefore uses her own egg, and the intended mother legalizes guardianship through a step-parent adoption. Gestational surrogacy occurs when IVF is performed between gametes of the intended parents, and the embryo is then implanted into the surrogate mother.
Why would you do it? Pregnancy was easy for me, that I would love to help a family who couldn't have a baby by themselves.
However, sometimes things don't go so smoothly.
Lachelle Baker agreed to be a surrogate for the Kehoes, whose struggle with infertility prompted them to invest $30,000 in an egg donor and a sperm donor and in vitro fertilization. Baker carried the babies, birthed them, and turned them over to the Kehoes. But then she changed her mind, only after she learned Amy Kehoe has a mental illness that requires medication and several arrests years ago for drugs and alcohol. Baker says she feared for the twins' safety.
I couldn't do it. I just couldn't do it. I would never have worked with a family that had these type of issues.
All 3 of these techniques are the cause of many controversies concerning ethical and legal issues. Because we can manipulate human life, does that mean that we should? Is it morally right that we can pick and choose the children we want? And since a surrogate mother is responsible for the birth of a child, does she have morally binding rights to that child?